All right, good afternoon, everyone, and welcome. I am so glad that you could all join us today for this important conversation about Medicare Open Enrollment. My name is Judd Meinhardt. I'm the Director of Financial Planning, a wealth manager and principal here at Modera Wealth Management. And if you're a client at our firm, I think you'll know that we believe our role is bigger than just managing portfolios and building retirement strategies. I think our core mission really sums it up well by declaring that our intent is really to make a lasting and positive impact on you, our clients' lives. Um, there are, I think, so many ways that we can do that, but one that I tend to focus on a lot is creating clarity out of confusion. And I think if we take a complex topic like Medicare, and we're able to act as a true partner to you, our clients, and help you navigate those decisions that are going to directly impact your health, and your peace of mind, that's something that's worthwhile for us to invest our time in. And that's part of the reason why today we're hosting this webinar. We have Christine Simone here with Move Health, who is the expert, I will say, in Medicare Open Enrollment. And over the next 30 to 40 minutes, she's going to walk us through some of the key things that you need to know about Medicare. We'll cover open enrollment timelines, the differences between original Medicare and Medicare Advantage plans, how drug plans are structured, and how factors like even your personal preferences and health needs, or even risk tolerance could influence some of those options or decisions that you might have to make. So the goal here is simple, right? We want to take a complex process and make it easier to understand for you so that you can feel confident with the choices that you make. And with that, I'll kick it over to you, Christine, to take it away.
Thank you so much, Judd. I am thrilled to be here with you guys. I think this is the third or fourth year that we've actually been doing this. For anyone who has attended any webinars in the past, you might have attended a webinar by Caribou, and I was the founder and CEO of that company. Our company got acquired by Move Health earlier this year, so we have the same great offering, plus a little bit more support with actual enrollment support, which is really exciting. But just so you know, we are the same partner that Modera has been working with for a number of years now. So it is, again, my honor to be here with you guys today. I'm going to go through just a little quick disclaimer and also just a brief more overview of who I am and what we do. And as I do that, I would love to just make sure that everyone knows how to use the chat in case you have a question. So I would love to hear from you. You don't have to give me your specific age, but if you could tell me in the chat, are you over 65? You can put 65 plus or write over 65 or your actual age if you'd like to share. Or are you under 65 and here just because you're curious about Medicare? I always like to know just the audience, who's here, and that way I can tailor some information according to which way the audience skews. But I think we'll probably have a good mix. Okay, just something really important to get out of the way. Move Health and Modera Wealth Management are unaffiliated entities. So Modera Wealth Management is an SEC registered investment advisor. I'm sure you all know that, where Move Health is a health insurance agency. Okay, the full disclaimer is here on the slide if you would like to review that. Now, while some of those chats come in, I see a good mix. Okay, we've got 84-year-old, over 65. We've got someone who's 62, 74. Turning 65 early next year, 64 last month. Happy belated birthday. Okay, we've got a good mix, as I presumed. Lots of 64-year-olds, so people who are coming up on Medicare, some curious, some over. Okay, great. I got a sense for who's in here. Now you all know how to use the chat. You can ask me questions throughout. I love to have an engaged audience, so I will be monitoring the chat throughout. That way I make sure that I am explaining things clearly, answering your questions before moving on. Some I might defer to the end, but for the most part, I can usually address them as we go through, okay? So I already mentioned my passion lies in healthcare planning. I've been, as I mentioned, the founder of a company that focused exclusively on this. I've been working on this for the last 5 or 6 years now. When I'm not doing that, I'm doing your stereotypical San Francisco type of stuff. That's where I live. It's unsurprisingly a foggy day today. That's what we're pretty used to out here. I know you all are joining from all sorts of different corners of the country or in the middle bits. And just so you know, our team has expertise everywhere. So by no means am I just an expert in the California market. We've got team members all over the place that know, the ins and outs of insurance where you all reside. So with that, I am going to give you guys another rundown. Judd already did, but just everything we're going to go through today is going to span the basics of Medicare. It is a great introduction for those who are joining who are under 65 but coming up on Medicare soon, but it is also a great refresher for anyone who is already on Medicare. Because when you make your initial Medicare selection, you might be thinking about making changes, which is what you can do during open enrollment. So we want to make sure that you understand the differences between traditional Medicare and Medicare Advantage before we get into anything else. We're going to talk a little bit about drug plans. We're going to talk about open enrollment timelines that will only be relevant to people who are already on Medicare. And then we're going to wrap it up with a little test. Again, I love to see the engagement. If you're willing to participate there at the end, we'll see if we get some participation there in the chat as well. And hopefully everyone is following throughout with the education that I'm going to walk through today. We already have a question in the chat. I'm happy to address it. Just learned today that our AARP Medicare Advantage plan is being discontinued. Why? Advice going forward, we were very happy with AARP. So that is something that happens. Unfortunately, Medicare is changing, not every day, but it changes very often. And some of those changes can involve carriers pulling out of some markets, depending on where you live. So I'm not sure maybe where you reside. It could be that they're pulling out of that specific market. Don't worry, you will be granted an enrollment period to enroll in new coverage. You're probably going to be able to do that during open enrollment anyways, but maybe chatting with a member of our team will help bring some more clarity to your exact timelines and maybe help you find a comparable option. Okay, Gary? We'll make sure you get that sorted out. So let's dive right in. We've got first things first, which is understanding the Medicare basics. And every time I explain this, I explain it a little bit differently. So if you want me to speed up, slow down, repeat, say it a third time, I am more than happy to. But I'm going to give it a go best I can here, and hopefully it resonates with you all. So when you first enroll in Medicare, you have your first big decision, which is choosing whether you want to enroll in what's called traditional Medicare or enrolling in what's called Medicare Advantage. So there are essentially two options to how you can configure your Medicare coverage. Traditional Medicare is also called original Medicare. And what you're going to do when you sign up for this type of Medicare coverage is you are first going to enroll in Parts A and Part B. That's coordinated through Social Security. Then you are going to enroll in a separate policy that covers your drugs. That's your Part D plan, and D stands for drugs, which makes it easy to remember. And then you also have to add a supplemental policy, also known as Medigap, to that coverage because Parts A and B only cover so much. We're going to get into what it covers, but you need, for full coverage, you need to have that Medigap plan or that supplemental plan, it's also called. So when you're enrolling in traditional Medicare, you feel like you're signing up for basically three different things. So through Social Security, you sign up for Part A and Part B. Then you pick a private insurance company to provide your Part D coverage. And then you pick another private insurance company to pick your Medigap coverage. So it sort of feels like you are dealing with three different entities, which you truly are. You will have three physical cards that will come in the mail. Your red, white, and blue Medicare card, that's your Part A and Part B, your Part D drug coverage, and then your Medigap card. And again, those two can be provided by two different insurance companies. So administratively, it can feel like a lot more of a burden than the alternative, which is Medicare Advantage. And that's also known as Part C. So they named Medicare with all these different pieces and parts. Truly, to me, it makes absolutely no sense that you would have Part A, B, and D on one side and then Part C on the other side. But that's just the way that it works, unfortunately. You can just refer to it as Medicare Advantage. Just make sure you're not confusing that you need A, B, C, and D. You need either A, B, and D or C completely independently. When you sign up for a Medicare Advantage plan, you still have to go through Social Security to get Parts A and Part B, but the difference is that it's all going to be coordinated through the company you pick for your Advantage plan. So like in the question in the chat, AARP, which is United Healthcare, is a provider that this individual enrolled with that is going to provide their Medicare coverage, and it is going to provide coverage for A and B, and then drug coverage, and then any supplemental coverage as well, all in one, added all together. There are some differences to these two types of coverages, and I'll walk you through them now, and I'm also going to keep repeating it throughout the slides because it is really important. When you're on traditional Medicare, you have the freedom to essentially go see any doctor or hospital in the country. It's like 98% of doctors and hospitals consider traditional Medicare or Medicare generally to be payment in full for their services. So you have tons of freedom where you don't have to worry about which doctors are in network and which ones are not. You will pay a premium for that coverage. So that Medigap plan is going to run you, anywhere between $70 to maybe even $500, depending on a bunch of different factors, which we'll talk about soon. So you are going to pay, an additional cost to get that freedom, but you have a lot more choice. You also have to add in some additional policies like vision and dental, which these parts do not cover. So you do have to consider that as well. Typically speaking, traditional Medicare will be more expensive on a month-to-month basis. On the other side, the Medicare Advantage side, you will have networks of doctors. So much like your employer-based plan or your marketplace plan, if you retired early, or maybe you're a small business owner or between jobs and you've ever enrolled in insurance through the exchange or the Affordable Care Act, much like those plans, you will have a network of doctors that you will have to go see. So you will have to check every time you go to the doctor or want to go to the doctor, you will have to check whether or not that doctor or facility is within network of your plan. So some people do feel a bit more restricted because it will typically be a local network of doctors that you can go to. And you will have to keep that in mind for not only doctors, but also things like skilled nursing facilities. The upside of Medicare Advantage is that you'll usually pay a much lower premium for these plans. So you have probably seen commercials or received flyers in the mail for, $0 Medicare Advantage plans. Those definitely exist. So you will typically pay less on a month-to-month basis, but you will have those restrictions, including they do have higher rates of denials for services or prior authorizations needed. You will, though, often get some additional benefits: dental, vision, fitness benefits, transportation benefits. There's lots in there that makes those Advantage plans very appealing to people. So it is all a personal preference in terms of which way you want to configure your Medicare coverage. And just keep in mind as we go through some more of these differences throughout the slides that everyone is different. Okay, so for some people, they might really prefer traditional Medicare, and for other people, they might really prefer Advantage. It all comes down to what's important to you. And I will add that also it does depend where you live. There are definitely some differences in the way these plans are structured, mostly on the Advantage side, that can make them more appealing in certain geographies. So we're getting lots of questions already in the chat. I'll answer a couple. Is United Healthcare an option for Medicare? Yes, but it depends where you live, is the quick answer to that. So United is a pretty predominant carrier for Medicare, I would say nationally, but it will depend on whether or not they offer a Medigap plan or a Medicare Advantage plan or both in your geography. Another quick question. I'm 64, birthday in December. I'm employed full-time with health benefits. I'm going to continue to work going forward with benefits. I recently signed up for A. Do I need to sign up for Part B at this time? The answer with Medicare is always, it depends. But James, it really does depend. You should ask your employer whether or not your coverage counts as credible coverage for Medicare. If the answer is yes, there is really no reason to sign up for Part B unless you plan to sign up for full Medicare and drop your employer plan. Just so you know, once you sign up for Part A, you can no longer contribute to an HSA if you were already doing that. So you have to stop those payments if you are contributing. So hopefully you can get a notice from your HR department there. I'm going to keep going, and then I'm going to make sure I get to everyone's questions by the end, okay? So when you enroll in either Medicare Advantage or traditional Medicare, you are getting Part A and Part B coverage, okay? So this is your hospital and your medical coverage. Just the way that the private insurance for Advantage covers it is administratively different, but that's all behind the scenes. It's not stuff that you really have to worry about. So you do get Part A and Part B coverage in both instances. Part A is that hospital coverage. Think inpatient hospital, skilled nursing facilities, home health care, hospice care. And generally speaking, which is why James signed up for Part A, you don't pay anything. As long as you have worked 40 work quarters, it's 10 years, you've paid your Medicare taxes for 10 years, you will not pay a monthly premium on your Part A. So oftentimes it makes sense to sign up for Part A unless you're still contributing to an HSA, in which case you might want to delay it, but you have to have credible coverage from an employer, either your employer and you're still working, or your spouse's employer who is still working. You can't have COBRA coverage. That's not considered credible coverage. You have a deductible for Part A, and it's $1,676 this year. I know Medicare released some numbers yesterday, but I don't think we got some figures like this in terms of what to expect for 2026, but it shouldn't be far off of this number. And this deductible is not an annual deductible, it's what's called per benefit period. And that benefit period basically means it begins when you are admitted to a hospital and ends when you haven't received any inpatient care for a consecutive 60 days. So you can have, multiple of these periods during a given year. It's going to cover 100% approved home health care, hospice, days 1 through 20 of skilled nursing, and then beyond that, you would have to pay a daily copay. Yes, I will be sending out the slides. Well, I'll provide them to Modera and I'll let them circulate the slides. Okay, Jim? Part B is your medical services. This is your doctor's appointments, outpatient, lab tests, and things of that nature. It's like your routine healthcare. This everyone pays a premium for, but some people pay more than others. Okay, so everyone starts at $185 a month. That's the amount for this year. Next year, probably we'll see it go up to like $195, maybe $200 a month. And then you will also pay an income adjustment on top of that. So for those who are over the age of 65, you've probably heard of something called IRMA. Maybe you haven't, and if you haven't, that's maybe a good thing in terms of how much you pay for your Medicare. But IRMA stands for Income Related Monthly Adjusted Amount. Don't worry, that won't be on the test later. But it is essentially an additional premium on top of your Part B premium that you're going to pay. And that is going to be dependent on your income from 2 years prior. We're going to go into that into a little more detail on the next slide. Let me just go through the rest of this Part B overview. With Part B, you have a $257 deductible, and that is per calendar year. Not a lot of money. A lot of people in their first few doctor's visits of the year, pay that deductible, and then they don't have to think about it anymore. That's probably one of the lower deductibles you've ever had in your, health insurance lifetime. Usually they can be, thousands of dollars. Once that deductible is met, though, if you only have Parts A and Part B, it's only going to cover 80% of services, meaning that you could be on the hook for 20% of every single bill you have if you only sign up for Parts A and Part B. And that's where signing up for Medigap comes into play and signing up for Medicare Advantage comes into play. Before we get to that, let's make sure that you guys have a good understanding of what IRMA is. I'm sure for anyone who's new to Medicare, you sort of perked up in your chair when I mentioned that you could pay more depending on your income from 2 years prior. These are 2025 numbers. We get the 2026 numbers in November, so we don't yet have them. But what you can do is you can find yourself on this chart. So you would look at the 3 different tax filing statuses in light blue. Let's say I had a spouse, we were both enrolling in Medicare. I would be here in column number 2. And let's say we made $350,000 back in 2023 for 2025. But if we're looking at next year, we're going to be thinking about 2024. Let's say for simplicity, our income is consistently $350,000. I would be down here in the 4th row of the table. And then I would go across and I would see that I pay $480.90 a month for my Part B. And then I'm going to pay an additional $57 also on my Part D coverage for my drugs based on my income from 2 years ago. So this is individual. This is not me plus my spouse. Unfortunately, this is completely individual. So you have to keep that in mind from a financial planning perspective, that if you are selling a house or you have any other means of, income from 2 years prior, that you want to consider that it will affect your Medicare premiums 2 years from now. You do have some relief in the form of being able to appeal your IRMA determination in the event that you have experienced some form of a life event like retirement. The Social Security calls it work stoppage, but retirement, where you're no longer generating that same level of income. So if that is you, if you made, $350,000 in 2024 and you're turning 65 next year, but you have retired between now and then, you will provide Social Security with a form. It's called SSA 44. You have to go do it. They're not going to do the work for you. So you've got to go Google this form. It's the first form that pops up when you Google it. It is 8 pages long, but you only have to fill out 2 pages, and it is a really simple form to fill out. You just have to tell them what was the qualifying life event, what was your income then, what's your income now, provide maybe some proof to that, and then submit it to Social Security. It is really straightforward. Our team will make sure that you are aware of how to do that process if you engage with our team. But if you did something like sell a house 2 years ago, like in my prior example that I provided you with, that is not going to be, unfortunately, a credible reason to appeal your IRMA. The most advantageous one that we typically see is either you retired. That's straightforward. They usually approve that. Maybe you've been widowed, or you got divorced and it's changed your income and your tax filing status. Those ones are typically approved as well. You'll see the different reasons on that form when you Google it. So, Mark, I think I just answered your question there. If our income goes down after I stop working, will the IRMA premium be adjusted? The answer is not automatically. You have to put in the work by filling out that form and submitting it to Social Security. When we get these 2026 numbers, we'll be updating your advisors. Hopefully they'll be able to send out an update to you all, or it could be just a really quick Google, on the Medicare website or the Social Security website. Always look there for those types of numbers. So when you have those parts A and part B, going back to that coverage, you only have 80% of coverage. So that's where you need to add additional coverage. We, generally speaking, do not suggest that anyone goes without one of Medigap or Advantage. Unless you have coverage through a spouse or workplace or something, we typically suggest you enroll in full coverage. Otherwise, you are on the hook for 20% of every single bill you will have moving forward. So option 1, a supplemental plan. I already went through the differences between traditional Medicare and Medicare Advantage, but this is where it makes a true difference. It's in that supplemental plan that 98% of doctors and hospitals will accept as payment in full. So you have way more freedom. You're going to pay a premium for this plan that is, again, anywhere in the $50 to $500 range, depending on where you live and your age and the options available to you. But you have that choice. No referrals needed. You get to go to any doctor or facility really that you want to. Some exceptions, of course, would be, like concierge medicine doctors who don't accept insurance. And there's some that just don't accept Medicare at all. But as long as you have established yourself as a patient somewhere, you can ask them the question of, do you accept Medicare patients? And as long as you've been a patient beforehand, you should have no issue. Sometimes there are issues where places will not take you as a new patient once you're Medicare eligible. You have to establish that relationship prior to. So that's something to think about for those people who have joined who are under 65. You have to add, though, a separate drug policy when you enroll in, traditional Medicare, which means this supplement or this Medigap plan. And we'll get to that in a little bit. With Advantage, oftentimes there is that drug policy bundled in, but not always. So it's something you want to look for in your Advantage coverage is, does it offer drug coverage embedded within it? It will also typically offer dental, vision, I mentioned transportation benefits, fitness benefits. Some people really love their Medicare Advantage plan because it pays for their membership to the YMCA or places like that. So there are some of those additional perks, but like I said, you will have more restrictions in the network, the people you can see, the facilities you can go to. You have to look in network to be able to have the plan pay for it. Usually these plans are $0 running up to maybe 100. I think 150 is like the most expensive plan maybe that I've ever seen on the Advantage side. So you would have cost savings from that perspective, but you will have more out-of-pocket costs. You will have some copays, some co-insurance, a larger out-of-pocket maximum. And I'm going to show you the financials of this now on the next few slides so that you can really visualize financially the differences between these two options. I've already mentioned a bunch of different pieces and parts. So part A, part B, now we're adding, either a supplement to it or a part C Advantage plan. When you add a supplement, you are picking not a part, but you're picking a plan. So very important distinction that when we are talking about plans, we are talking about Medigap options. When we are talking about parts, we're talking about that hospital and medical coverage and that drug coverage. Intentionally confusing, I know. I'm not the one who named it, so I'm just here delivering the message to really keep a close eye on what you're really looking at if you are looking at this independently. Hopefully you're working with us to be able to help you make sense of all of this, because this is where stuff gets really confusing. When you enroll in a Medigap plan, you are picking a letter. There are 12 different letters that you can enroll in, everywhere from, I think it skips a few letters, but I think anywhere, oh, it definitely skips a few letters, from A to N. So you can see here a chart. I'm just gonna go back from that for a second and I'll go back to it on the next slide. You're picking a letter for what kind of Medigap coverage you want. So you still have choice when you have a Medigap plan. For the most part, most people are enrolling in what's called a Plan G. This is the most comprehensive coverage that you can get today. If you turn 65, which there was some people who turned 65 well before January of 2020, you might have been enrolled in a Plan F. These plans are very similar with the exception of that $257 deductible that you don't have to pay on Plan F, but it's not available anymore. If you are new to Medicare, you can only enroll in a Plan G. It's your most comprehensive coverage. It's going to cover everything that you need from a Medigap perspective. And the only thing to keep in mind is if you live in Wisconsin, Minnesota, or Massachusetts, you have a slightly different version nomenclature-wise. You don't have letters. You have things like core and supplement plans, but you can find the equivalent of a Plan G. So our team can help you structure your coverage so it is the equivalent of a Plan G. And that's going to be the most common one that we see across the board with the many clients we work with who are working with a financial advisor. Usually if, cost is not an object or you do really value that freedom and knowing that your plan is going to cover you for everything that you need, this Plan G is going to be the best option for you. Now, everyone's different, and some people do want to explore different letters. Some other common ones might be a high deductible G. If you want to lower the premium, you can get G in a high deductible form. Plan Ns can be kind of common. We don't see much enrollment either at our company or broadly speaking, much enrollment in any of these other lettered plans. So they're not common, but if you do have any questions about them, definitely, it's a question that our team can answer and provide some more clarity on if you are considering some other options. We don't have to go through this in detail. If you want to take a screenshot of it, it's also on the Medicare website. You'll also get this recording. But just so you know, most of who we're working with is enrolling in a Plan G to make sure that they have that comprehensive coverage for everything that they need healthcare-wise. One more important note. Every Plan G, whether you enroll from, whether you enroll through Cigna, Humana, AARP, Aetna, whoever you enroll with, every Plan G is created equal. So these are the baseline benefits that Plan G provides. So typically speaking, which leads me nicely into this next slide, typically speaking, when we are comparing different Medigap options, especially within the same letter, we're really looking at only a few things. What is the premium of that plan? What is the carrier stability? Will they pull out of the market? Can they financially support a business? How many years have they been in the market? And what's the potential rate increase of this plan based on historical data? So you want to make sure that you're comparing. You can see here in the top row, I think you can see my cursor. There's a plan that's 176, one that's 190. And wait a minute, this one's 116. Why is it so much less? Well, that's because it's a high deductible Plan G. So while these first two ones have a $257 deductible, this one has a $2,800 deductible, or almost $2,900 deductible. So that is a potential trade-off of a lower premium if it's worth it to you. You can see that if you max out that plan, you'll pay annually $4,200 versus $2,500 on these first, or $2,300 on these first two plans. So it's a pretty simple comparison when you're looking at these. Our team, of course, has access to this sort of data to be able to say, well, Globe Life maybe is 176 a month today, but they've been known to hike their premiums 10% after your first year or something like that. So that is the type of data that we have access to be able to inform you not only on today, but also on the future. Because one of the most important things to know about Medigap plans is that this is a plan that you want to plan for to have for the rest of your life. If you ever want to switch your Medigap plan, you have to go through medical underwriting unless you live in Connecticut, Maine, Massachusetts, or New York. So those are the 4 lucky states right now where they don't have to go through medical underwriting to switch. But anywhere else in the country, if you initially enrolled in Globe Life and then you decided you wanted AARP in 2 years, they would put you through underwriting most of the time. Some carriers have some exceptions, but for the most part, you can expect that you will have to go through medical underwriting to be approved for a different Medigap plan. So you really want to be thinking long term. Couple good questions in the chat. Should I switch from F to G? The answer is it depends, but probably. I would say that with quite a bit amount of confidence is that probably your premium for your plan F is more than $257 more expensive a year than it would be to switch to a plan G, if that makes sense. So let's say your plan, Pamela, was an extra $50 a month in comparison to a plan G. That would be well beyond the $257 deductible that you'd have to pay on plan G, which you're not currently paying on plan F. So I would think about that to consider, and that's a conversation that our team would be happy to have with you. One question, can you talk about foreign travel coverage? When do we need to buy travel medical insurance? What coverage? Really good question. At a high level, my understanding of the foreign travel emergency is at a high level. One of our agents could probably better answer that question than me, but we do always recommend that if you're traveling abroad, even with a plan G, that you get additional travel insurance. And that is something that our team is able to provide you with as a product. So we do have some options there for you, just because if you have some form of an emergency, it's probably quite severe. And I think that one of the things you need to keep in mind is the benefits to get you home safely to your home where you want to potentially receive care. I am going to show an example of all the costs of all the normal options like A, B, Medigap, and dental throughout these slides, Mark. So hopefully let me know near the end if you feel like I haven't provided that yet. I'll take one more question here. I am self-employed, currently buy insurance through the marketplace. When I turn 65 and enroll in Medicare, how do I cover my wife who will only be 62? They will still have marketplace coverage. So they will have to stay on the marketplace and you will be on Medicare. So you will have 2 different policies. Medicare anyways is completely individual. So even if you were both 65, you would be enrolling completely separately. So you will have that different coverage for, the 3 years that you are over 65 and she is not. Lots of great questions, guys. I love it. Keep it coming. Hopefully I am able, let's do a time check. Oh yeah, we're good. Okay. So let's now pivot a little bit. We're still talking about the basics of Medicare here. This is the bulk of the presentation, okay? Now, if you decided you didn't want traditional or original Medicare, as it's called, either or, you would be enrolling in Medicare Advantage. Again, because parts A and B only cover 80% of the costs. When you enroll in Medicare Advantage, you are picking one single private insurance company. Could be Cigna, Aetna, Humana, AARP, Blue Cross Blue Shield, whomever. You're enrolling in just that one company. They are going to coordinate all of your benefits for you. So when you get that Medicare card in the mail for your A and B, you can actually store it away. You don't ever need to bring it to the doctor's office. You just have your Medicare Advantage card, and that's what you will use exclusively. So administratively, it is a lot more simple. You're dealing with one insurance company versus the other side, you've got 2 different insurance companies and then your A and B benefits. But again, what you need to know is you will be restricted to those networks. Every plan has a network type and then the doctors who fall under that network. So you might have seen these acronyms before, HMOs, PPOs, there's even a hybrid version called an EPO or a POS. For the most part, plans will be structured like an HMO or a PPO, meaning that if you're on an HMO, everything is coordinated through your primary care physician and you need a referral to see a specialist. Whereas with a PPO, you have more flexibility to not only see specialists on your own, but it does provide some out-of-network care as well. Usually speaking, PPOs might be a little bit pricier than an HMO, but generally speaking, Medicare Advantage is a lot less expensive than traditional Medicare. You will, though, have co-pays, co-insurance, and an out-of-pocket maximum of maybe $2,000, $3,000, $4,000, $5,000 a year. So it is a very different structure of insurance where you're paying less a month, but you will be exposed to more potential out-of-pocket costs. So that is really the difference in terms of trade-off here with these two options from a cost perspective, but also a benefit perspective. You will have maybe some extra perks like dental and vision, but you will be restricted to a network of providers that you have to go to. So I know I've already said that probably 3-4 times at this point, but it is really, really important. If you are seeing any commercials on TV, they are Medicare Advantage plans. For the most part, I can say that with 99% confidence that for the most part, what you're hearing in terms of advertisements, Sunday football commercials, things like that, it's going to be a Medicare Advantage plan. If anything's being advertised as $0 or anything's being advertised as additional benefits like dental and vision, these are Advantage plans. Again, everyone is different. Some people love these plans. I live in California, where we have Kaiser as a very prominent provider of these plans, and people have been with Kaiser for their entire lives, and they love Kaiser. And so no surprise that over 50% of Medicare beneficiaries in California are enrolled in Advantage plans. So that is also where geographically it can be a very big difference depending on where you reside too. There's a question back to travel benefits in the chat. Don't some credit cards purchased provide some type of travel insurance coverage? From a medical perspective, I am not sure about that. I know that some credit cards provide like travel interruption coverage or like loss of luggage, flight delay, stuff like that. But we're talking like purely medical coverage if you had an emergency abroad and needing coverage when it comes to that Plan G and the 80% of foreign travel coverage that it provides. One more question here. My wife is retired and turned 65 in February, currently on the ACA, which stands for Affordable Care Act. To be fully covered, should she just get January 2025 plan through ACA? Yes, we would recommend that. There are some other options, Kevin. You could potentially bridge her 1 year with a short-term plan if she's got no like medical, appointments or doctor's visits that she's expecting that will just cover emergency. You can do that, or you can just keep her on this plan for 1 year and then have that Medicare coverage effective February. Okay, one more. My spouse is not eligible for Social Security. Will she be covered under my Medicare plan? You can only cover yourself on your Medicare plan. You cannot cover somebody else. It's only you. Someone could be eligible depending on things like a disability for Medicare early or through like SSDI based on your income, but you would not be able to cover someone on your own Medicare plan if they're not eligible for Social Security. Medicare is purely based off of your age. So that's something to keep in mind. Okay, going back to the content here. We've got a lot more to consider when we are considering Medicare Advantage. So I showed you that table of Medigap options. When you're looking at Medicare Advantage, you are looking at medical as well as drug combined, as well as your provider networks. So not only do you have to consider the plan type here, which is the HMO, PPO, you have to consider the cost of the plans. We've got some $0 plans. We've got $17, $90 plans. You have to consider the out-of-pocket maximum of each of those plans, $2,500, $3,500, $2,000, $1,500. IRMA will come into play for Medicare Advantage. So I haven't mentioned that yet, but you're not skipping out on IRMA because you enrolled in Medicare Advantage and not traditional Medicare. You're still going to pay the Part B and Part D IRMA for your income 2 years prior. But then you also need to consider your estimated drug costs. So it's like everything bundled in together that you need to think about, including which doctors and hospitals are in network and including which medications are covered and what is the estimated cost of those medications. So it is a much more comprehensive evaluation of which plan is better for me, which is why Medicare Advantage, I mean, all parts of Medicare, but Medicare Advantage especially, so important to check every single year to make sure that the plan that you're on is still the best plan for you. I know that some people love some benefits that they get through some company like AARP. People love that AARP plan for the most part, but AARP might not provide the best coverage for your medication list as your medications have changed over the years, or they might not cover some of your doctors anymore. So you really need to keep that in mind and evaluate this coverage. And we're going to talk about those timelines here in a few minutes. This level of detail is the level of detail that we would recommend going through if you are considering initially enrolling in Medicare Advantage or switching your plan. I know that at, Thanksgiving dinner or meeting, your friends or families over the holidays, sometimes people start to rave about what they like with their plan and how well it's working for them. This is such a personal decision to make. So do keep that in mind. Don't necessarily get enticed by what other people are doing or by, something you might see on TV or get an email about. Really do keep in mind that you have to go through this level of detail for your evaluation of your plan. I'm going to save now the rest of the questions into the end, just because I want to make sure we get through everything. So feel free to continue to put them in there, but I am going to keep moving forward with now describing Medicare drug plans, because this is an area where we have seen some changes. When you first enroll in Medicare, you've got those two options. I had mentioned Part D, D standing for drug. That is your second policy that you're going to enroll in on top of your Medigap policy when you go with traditional Medicare. With Medicare Advantage, I had already shown you an example where you can see that that coverage is embedded within that Medicare plan. Not all plans will have it though, so you need to make sure that it is providing drug coverage when you're enrolling in Medicare. If you're going the Part D drug route, you want to make sure that you know that this is provided by a private insurance company and that you will have a premium for this plan. So every plan, whether you enroll through Aetna, WellCare, United, Blue Cross Blue Shield, it will have a different premium for that plan. And then on top of that premium, if you've been paying attention, you will pay that adjustment based on your income from 2 years prior. So that IRMA applies to both Part B and Part D. Doesn't apply to your Medigap. It does apply to Part B and Part D, and that is whether you're on traditional Medicare or Medicare Advantage. And those premiums will vary from plan to plan. When you are picking a plan, you want to make sure that the most important thing you're looking at is the cost of your medications on that plan. Of course, you want to be mindful of the premium of that plan too, but just so you know, a $100 drug plan doesn't necessarily cover your drugs any better than a $4 drug plan. So you want to make sure you're evaluating the cost of each of your individual medications that you can expect over the next year on that specific drug plan. That point is really important. I said over the next year. You can change your Part D drug coverage every single year, and it's one of the, the most things that we do during open enrollment is helping people change their Part D drug coverage. When you are on Medicare, you have a list of Medicare approved drugs, but then there is also a list of medications that your plan covers. So some plans might cover a drug and some plans might not. A really good example is GLP-1s, which are very popular now. There are some plans that cover them and some plans that do not. So you want to make sure that your plan is covering those medications. Otherwise, you will be fully responsible for the cost of those medications. If you are taking only covered medications, you will not pay more than $2,100 in 2026 for your drugs. So there is a cap on these drug costs for those who are over 65, like those in their 70s and 80s. You definitely remember this used to be uncapped. So this cap only came out this year. 2025 was the first year that this was capped at $2,000. Next year, it's going to be $2,100. But again, this is only for covered medications. You have to make sure the plan that you're on is covering that medication. Just because it's a Medicare approved drug doesn't mean that your plan necessarily covers it. So when you work with our team, we ask you for all your medications. That's why we ask those sorts of questions, to be able to ensure that the plan that we are recommending to you provides the best coverage for those drugs. And this is what that evaluation looks like. So you can see here, First row, $0 versus $12. Yes, some places have $0 plans. So, just because a plan is more expensive does not mean it provides better drug pricing. You can see here $80 versus $20 for this one medication. What also matters is the pharmacy that you go to. So certain pharmacies will be in network, preferred, standard, or out of network. So the preferred pharmacies will provide usually the most cost-effective pricing for you. Really, all you're looking at here is what is the cost of my medications on a specific drug plan. Again, you can change this every single year, so you don't have to worry about the what ifs, but you also don't want to forget to change this. If you're sitting there and you're like, well, I don't take any drugs, do I need drug coverage? The answer is yes. If you do not enroll in drug coverage when you are first eligible for Medicare, it exposes you to two things. One, you cannot just pick up a drug plan whenever you feel like it. So if you get prescribed a medication, you will be without drug coverage until January 1st of the following year. So if it's March and you get prescribed a medication, you are paying out of pocket for the rest of that year. Second, you will be exposed to a late enrollment penalty for every month you did not have drug coverage. So Medicare just doesn't want you to pick up drug coverage just when you need it. So they're going to tally all the months that you didn't have drug coverage. It's nothing crazy. It's something like 10 cents a month for every month you didn't have it. So it's not a crazy amount of money, but it will stick with you for the rest of your life. And like I showed you on the prior slide, in most markets, you have a $0 plan option, or you have like a $2 or $4 or $5 or $7 plan option. So typically speaking, it is worth it to have that plan in the event that you get prescribed a medication, or to avoid that late enrollment penalty later on in your life. The only kind of caveat to that would be if you have credible drug coverage from another source, and that is typically through TRICARE or the VA, or if you are still working or your spouse is still working and has coverage there to be able to provide. It needs to be credible coverage. So the HR departments will know what credible coverage means. Again, I mentioned this earlier, but to repeat, COBRA coverage does not count as credible coverage. So if you were working and then you extended your workplace coverage through something called COBRA, that does not count. You also can't keep your marketplace coverage to cover that. Once you turn 65, you need to enroll in Medicare unless you or your spouse are still actively working. Some plans on Medicare Advantage do have drug coverage, some plans don't. So make sure you're checking for whether or not they have drug coverage. We're going to talk about important timelines for open enrollment, but I saw a question in the chat about the timelines for enrolling when you're first eligible, and it's worth addressing here as well. So for anyone who's under 65, keep in mind that if you are not working, you have 3 months before the month you turn 65, the month of your birthday, and then 3 months following the month you turn 65 to set up all of your Medicare coverage. It is a 7-month window that you have to do it. Do not wait, get it done. Ideally in the first 3 months you're first eligible. The soonest it can go into effect is the month you turn 65, but it can go into effect the month after, the month after, the month after, all in that initial enrollment period window if you would like. If you are still working, or you are married to somebody who is still actively working, who has credible coverage, then your timeline is typically a bit different. It will come down to a lot of different things, like is that coverage credible? What's the premium of that plan? Should I enroll in just A? Am I contributing still to an HSA? Should I enroll in everything and drop the workplace plan? Generally speaking, again, it's a very personal decision, so I'm not going to give every single timeline, but if you are retiring past 65, we recommend you get it all done within 60 days of the day your coverage stops. So if you are working past 65 and you've delayed your Medicare coverage, just know that typically speaking, we recommend you get everything done within 60 days of losing that workplace coverage. And again, COBRA does not count. COBRA doesn't give you any extra time. You want to make sure you're getting everything done really quickly. Okay? If you are already on Medicare, now this time of year is the best time of year. It's the time where you can reevaluate things. You can make changes. You can see here, there is what's called an annual enrollment period. This runs from October 15th to December 7th. Now, if you're like me and you're not good at remembering dates, just remember November. That's all you have to remember during the month of November. You can change your Medicare coverage, get it done before Thanksgiving. That way you get no opinions. And then you know you met the deadline and you were able to get it done. What you can do during this time, the most common thing we see is people switching their drug plans. Most of who we work with, again, is on traditional Medicare. They are enrolling in a Plan G, and then they have a separate Part D policy. They are looking to switch that Part D policy to one that fits their needs for the upcoming year. You can also, though, switch from original Medicare to Medicare Advantage if you'd like to make that switch. You can also switch from Medicare Advantage to original Medicare. But if you've been paying attention, you might remember I said you would be exposed to medical underwriting if you decided you didn't like your Medicare Advantage plan anymore and you wanted to go to original Medicare and get that Medigap or supplemental policy. You can also switch your Medicare Advantage plan, no questions asked, so you can hop around from plan to plan, and then you can switch to a Medicare Advantage plan that does offer drug coverage to one that doesn't, or the reverse. But again, you shouldn't have no drug coverage unless you have it from a different source. There is also a separate period, two different periods technically that run by the same date though. One's called Medicare Advantage Open Enrollment Period and one's called General Enrollment Period. For the Medicare Advantage Open Enrollment Period, you have an extended 3 months to switch your Medicare Advantage plan. So you can do that as well during the first quarter of the new year. You can also drop your Advantage plan and return to original Medicare, plus join a separate drug policy. But again, you would be exposed to that medical underwriting if you wanted to get a Medigap plan. The general enrollment period is for those who missed their initial enrollment in Medicare. So if you turn 65 and you missed that 7-month window that I was just telling you about, the only time where you can pick up Part A and Part B is during this time of the year. Otherwise, you can't just enroll in A and B when you feel like it. You have to do it during this time of the year. If you are on traditional Medicare, you cannot switch your drug plan during this time. So what I like to say, I like to tell you guys these dates, but what I like to say is just focus on this. This is the time of year where you can make all the changes you need to make unless you missed your initial enrollment in Medicare, in which case you have to wait until January to get Part A and Part B. But if you're already on Medicare, you can do everything you need to do, whether you have traditional Medicare or Medicare Advantage, in the month of November. So just remember the month of November. That's the month you want to get it done. It coincidentally coincides with the marketplace or ACA open enrollment too. So if you have a spouse, which many of you have expressed in the chat, or you're on the marketplace yourself who has marketplace coverage during the month of November, you can also make changes to that coverage. And all of these changes will go into effect January 1. So you want to make sure that November is like your health insurance month and that you're focusing on those key dates. So now, wrapping everything up together, and then we should have at least 4 or 5 minutes for questions. I want to make sure that you all were paying attention. I've got here a table of both traditional Medicare and Medicare Advantage side by side. You can see there is Part A for both. You're paying $0 a month if you've paid your Medicare taxes for 10 years. You can then see there is a Part B premium for both. You pay $185 minimum, but in this case, this person has a $100 additional surcharge for their Part B premium. With traditional Medicare, we have a $195 a month Medigap plan, and then we have a $7 Part D drug plan, and IRMA is added into that drug plan too. On the other side, you have Advantage, which is $0 a month, but you're still paying that Part D IRMA. Add all these numbers up, we've got $532 a month on traditional Medicare, and we have $300 a month on Medicare Advantage. So that aligns with what I've been telling you. Typically, you pay less on a month-to-month basis. But in this case, we've got $257 deductible. Add that all together, annually, we might pay $6,600. But on this side, we've got a $2,500 deductible. So add that all together, and every year we might pay around $6,400 or $6,500. So it doesn't look that different financially. If you're accessing healthcare services every year, your exposure, your annual risk is going to look pretty similar in some cases. Sometimes we can see this tilted that way, and sometimes we see it tilted that way. Again, it really, really depends on where you live and the options available to you, and a little bit your age as well. But what's not pictured here? So in the chat, for those who've been paying close attention, if I'm purely looking at the financials of these two options, What is not pictured here in this slide? If we're purely looking at just the financials. There's gotta be someone. I know it's coming. I know someone's typing. Additional coverages. Yes, really good. Dental vision. Is it included in Medicare Advantage? Is it an additional expense on the traditional side? Good. Good example. What else? Copays. Great. Advantage side is going to have those copays, whereas traditional Medicare is not. If you're enrolled in a Part D drug plan, there's going to be, when you go to the doctor, you're going to need to pay out of pocket. Out of pocket drugs, yes, not included here at all, but it's going to apply to both sides, but both sides can cover that very differently. Out of network doctors, yes, just your networks, generally speaking, your preferred doctors, exactly. That's not what's shown in these two options. So my point to this is that your coverage is so personal to you and everything that you need covered based on your healthcare needs. If we ever meet somebody, a couple, and they are enrolled in the exact same plan, usually one of them is on the wrong plan. Unless they go see all the same doctors and they both have either the same medications or no medications. And that very well could be the case. But for the most part, you want to make sure that you are choosing your Medicare coverage completely individually based on what's important to you, based on all of the great, data that we have available to us to be able to best guide you. It is such a personal decision. So before I open it up to questions in the chat here, I just want to reinforce that that's what we're here for. We are here to help you review your coverage, go through your options, make sure you're on the best coverage for you. This is the only time of the year that you can do it. Of course, if you're new to Medicare next year, we want to speak with you as well. But for the month of November specifically, we want to be speaking with anyone who already has Medicare coverage. Unless you're turning 65 in like January or February, then of course we want to meet you. But for the most part, we're going to be focusing on those people with Medicare coverage. That means looking at your Medigap plan, looking at your Part D drug plan, and looking at your Advantage plan. We're going to be looking at a lot of things and make sure that we are able to configure your coverage for you. I already mentioned this, but if you have a spouse or a friend or a neighbor, introduce them to your advisor if they're under 65 or over 65. We do this great work in both areas. So just know that we do provide this to you as a service paid for by Modera. It is a great additional benefit that you get as a client through them. And so I hope this was informative. I hope I went through, as many questions as I can. I'm going to try to maybe do just a couple of more as I go through the chat. And if you asked one way early up and you feel like I didn't answer it, post it again if you don't mind, just for simplicity's sake. But I want to make sure, Judd, before I take a few questions, do you have anything you want to say?
No, awesome presentation, Christine. We appreciate it. Just for anybody who didn't get their question answered, I've been taking those down and I will distribute out to all the Modera advisors too. So if we don't get to all of them here, hopefully you can get a response from your advisor as well.
Fantastic. So here's one. I plan to retire at 65 in August. When should you start the process? We would typically recommend when that initial enrollment period starts for you, which is the 3 months before the month you turn 65. I am also an August baby, so shout out to Deborah. That would mean July, June, May. May, you'd want to start that process. Question about how to get our annual review with Move Health. Contact your advisor. Great question. I forgot that. Contact your advisor, reach out to them, let them know you are interested. We're asking for all of those requests to start coming in next week. So if you are interested, you can send them the email now. Hopefully they put you through next week. We just got the plans yesterday, so we're going to be able to start doing those reviews. If I turn 65 in April, when do I have to enroll? So that would bring us to January. So you would want to start that process in January. Mark, definitely for you. Don't worry about this open enrollment season. Even you could wait until January to really start the conversation to be able to have the 2026 plan data and not interfere with anyone who needs to review their coverage during open enrollment. Let's see, are Advantage plans required to approve procedures covered by traditional Medicare, or can they deny payment for procedures covered by traditional Medicare? It's a really good question. So your Advantage plan has the discretion to say, this doesn't seem medically necessary. You could appeal that decision. You could work with your doctor to get it approved. It is just sometimes additional hoops that you might have to climb through. And that type of thing, you don't see as much on the traditional Medicare side. So it's not like it is definitely something that you could get done on the traditional Medicare side, but generally speaking, we do see higher rates of that on the Advantage side. I think I might have covered everything. I think with that, we will close there and say that if you have questions that were not answered, I'm seeing like a lot of personal questions around like specific areas where you live. Broadly, I don't have any of that information committed to knowledge, unfortunately. I don't have a brain like that can remember all of that, but our team can look into that for you. So I think that if you have any question that has gone unanswered, anything highly specific based on your needs or where you live, get in contact with your advisor. Again, it was an absolute pleasure to go through this with you all today. Thank you for the opportunity, and I hope to see you during open enrollment or when you turn 65.
Yeah. Thank you, Christine, and thank you. Oh, you ended it. Okay. Oh, thank you all for tuning in.
Thank you guys. Bye-bye.